but we're going to also now move to Rebecca Puhl. So have you ever heard of a doctor, like you heard them talk, right? And you say to yourself, like, wait, are they speaking English? Right? Like, I'm not sure sometimes that we speak the same language, right? So Rebecca Puhl is a professor of human development and family sciences at the University of Connecticut and deputy director of the Rudd Center for Food Policy and Obesity, where she leads policy and research efforts aimed at reducing weight-based stigma and discrimination. And she is someone who is trying to bridge this gap of understanding between that belief system that we call stigma and the scientific manifestation of those beliefs as expressed in medical health outcomes, right? Actual health outcomes of real people, right? She's a national research expert on weight stigma and has testified in legislative hearings on weight discrimination. She routinely provides expertise on strategies to reduce weight bias to national and international health organizations, right? And she is here with us today. Welcome, Rebecca. Thanks for coming. Thanks for joining us.
Thanks very much. And thanks for the invitation to speak to you today and to be a part of the important discussions in the D20 forum. So as a researcher, I've spent almost 20 years studying stigma and discrimination toward people who have obesity. And today I'd like to talk about how important it is to have research on disease stigma in order to effectively raise awareness, mobilize change, and inform policy. And specifically, I'd like to share with you the ways in which our research has really helped to address obesity stigma, which has many parallels to diabetes stigma. So first, it's important to understand why disease stigma exists if we want to effectively change societal attitudes and reduce stigma. Disease stigma is a social construction of illness. It involves making moral judgments about the reason why a person has their disease and the pre-existing attitudes that we have towards groups of people who are most affected by the disease. And disease stigma occurs when people are blamed for their disease, when they're assumed to be personally at fault or lazy or immoral or lacking in willpower. And as a result of these stereotypes and assumptions, people are harmed not only by the disease itself, but by public and social responses to their disease. And the harmful impacts of disease stigma are numerous. We know that stigma worsens disease outcomes and health disparities that already exist for individuals who are most likely to be affected by disease. It induces stress-related illness. It lowers quality of care. It impairs preventive health behaviors and patient-provider communication. It reduces healthcare utilization. It interferes with effective prevention and treatment. And beyond these direct consequences for physical health, it creates inequities in employment and it worsens social relationships. And it really simply worsens the quality of a person's life. And this information isn't new. We've known this for many decades that stigma impairs health. And the list that you see here on this slide reflects examples of diseases or conditions that have been stigmatized, ranging from cholera to HIV/AIDS. And what these all have in common is that there has been broad recognition that stigma undermines their prevention and treatment. And public health policies have been created to address stigma as a legitimate barrier. And this has led to increased funding and research and programs to address stigma. But other stigma-related diseases haven't received this kind of attention. And when I started as a researcher studying obesity stigma, it wasn't recognized as a disease stigma. It wasn't on the radar. And although there is a long-standing consensus that stigma undermines public health, this principle really wasn't being applied to obesity. So I'd like to share with you what we've learned from our research on obesity stigma and the ways in which research has really been critical in efforts to bring attention to obesity stigma and actions to address it. And this is relevant to diabetes stigma for several reasons. First of all, like obesity stigma has been for a very long time, diabetes stigma hasn't received the attention, the research, the funding, or policy action that it needs. Second, obesity stigma is highly relevant to diabetes, given that many people with type 2 diabetes also have obesity. And third, obesity and diabetes share many of the same stigmatizing characteristics. So that is, foundational assumptions and stereotypes about obesity and diabetes strongly overlap in many cases. Both of these are diseases in which people who have them are assumed to be personally at fault and to blame for their disease. They're assumed to have developed their disease as a result of lack of willpower or discipline, or being unmotivated to improve their health, and assumed to be non-compliant with treatment or intervention. And these are the foundational beliefs that need to be changed to shift the current culture of blame towards obesity and diabetes. So I'd like to share with you the ways in which research has been critical in efforts to address obesity stigma, particularly over the past decade. And there are 5 key roles that research has played to help shift societal attitudes and mobilize change. The first is that research has provided a necessary foundation of knowledge and scientific credibility to the issue of obesity stigma. Second, research on obesity has played a key role in helping to increase public awareness of this issue. Third, scientific evidence has helped to mobilize the medical community to take this issue seriously. Fourth, research studies have provided evidence that have been instrumental in influencing policy initiatives. And 5, science has been absolutely necessary to develop and test effective strategies to reduce weight stigma. So I'd like to spend a few minutes highlighting some examples of each of these. So first and fundamentally, to convince the public, the medical community, and policymakers that obesity stigma needs to be addressed, we first needed to provide the facts. We needed to have a foundation of clear evidence to convince people that obesity is a prevalent problem facing Americans. And through multiple national studies in the US, research has established that weight discrimination affects up to 40% of the population, with rates highest among people who have the highest body weight, and especially among women. Research studies also show that weight discrimination is very common compared to other forms of discrimination in our society, like age and race, and that it negatively affects people in many different societal settings. This kind of evidence was really key to help demonstrate weight stigma as a legitimate problem and to give it credibility. Now, part of this foundation of knowledge also involved research evidence to show the many harms of weight stigma. And we've learned from research that in addition to the emotional distress that people experience because of weight stigma, it also worsens their eating behaviors, it lowers their levels of physical activity, and it even worsens their body's physiological stress responses. Moreover, a striking finding in research is that experiencing weight stigma predicts increases in weight gain and obesity. And this evidence has been particularly important in challenging societal weight stigma because there remains widespread beliefs in our society that stigmatizing people or shaming them about their weight will motivate them to lose weight, that stigma will somehow provide an incentive for weight loss. But what we see from science is the opposite is true. Stigma is actually contributing to the condition that people are being stigmatized for having. And collectively, this scientific evidence has been very important in convincing the medical community that weight stigma is harmful to health, and that this is a public health issue and that weight stigma cannot be ignored. Now, a second way that research has been important in efforts to address obesity stigma is that it has provided key information that has been broadly disseminated to increase public awareness. And part of the responsibility of researchers is to communicate their research findings to groups who can use it for meaningful action. The mass media is one of those groups. And a lot of our research on weight stigma has received national press attention, which has really helped put this issue on the radar in the general population. So we've worked very hard to establish positive relationships with reporters and news outlets who really look to us as credible scientific experts on this issue. And all of the media pieces that I've highlighted on this slide report on how weight stigma harms people's lives using our research evidence. And so broadly, as part of efforts to address disease stigma and diabetes stigma, there needs to be ongoing communication between scientists and the press to disseminate relevant and compelling evidence to the public. A third way that research has been critical is to mobilize the medical community to address weight stigma. And in particular, research evidence demonstrating the harmful health consequences of weight stigma has been very influential in both increasing awareness in the medical field and in motivating actions to address this problem. And a recent example to highlight here on this slide is a joint international consensus statement that was published in the journal Nature Medicine in March of 2020. More than 100 medical and scientific organizations worldwide endorsed a consensus statement based on the scientific evidence of obesity stigma, and they pledged their support to end obesity stigma. This initiative was completely driven by the scientific literature. And really, for the first time, we have a global group of experts and organizations that are speaking with one voice to condemn obesity stigma and pledge to help address this problem. Now, another example of the importance of research evidence is the role it has played in providing relevant evidence for policy initiatives to address obesity stigma. Science on the prevalence and the harmful health consequences of weight stigma have been very important for several different policy initiatives. One example is efforts by state legislators to introduce state legislation to prohibit weight discrimination. Massachusetts has actually introduced this legislation a number of times and is getting closer to a victory. A second example is the American Medical Association, who passed resolutions in recent years to address obesity stigma through education of healthcare providers and non-stigmatizing language and communication. And a third example is the American Academy of Pediatrics, who published the first policy statement on weight stigma in children. And that policy statement summarized the research evidence on the harmful consequences of weight stigma affecting children and really recommends that pediatricians address weight stigma in their clinical practice with youth and families. None of these policy initiatives would have progressed or been established without research evidence. And finally, we simply can't effectively reduce disease stigma if we don't understand the origins of stigma and how it works. And research has been critical in identifying strategies to tackle obesity stigma in our society. We've observed from this research evidence how important it is to target people's beliefs and understanding about the causes of obesity and to use multiple stigma reduction intervention methods. We're also seeing, though, that this is a difficult form of stigma to eradicate, and it appears to be more resistant to change than other forms of stigma in our society. So if we want to successfully shift societal attitudes, we need evidence-based strategies that will work. Changing societal attitudes is complex. It's not easy or straightforward, and science is key in order to make progress. So the examples I've just highlighted all emphasize why research is important in reducing disease stigma. Now, research on diabetes stigma does exist, but it's somewhat sparse and scattered compared to science on other disease stigmas, and we need more research to help tackle this problem, particularly in the US. So I'd like to share with you some of my team's very recent research published just last month on diabetes stigma among Americans who have type 2 diabetes. And essentially, we found that 40 to 60% of adults with type 2 diabetes reported experiencing different forms of diabetes stigma. And people who reported these experiences were more likely to have unhealthy eating behaviors like binge eating. And in addition to experiencing diabetes stigma, we also assessed whether people with diabetes were internalizing this stigma, blaming themselves. And we found that when people internalized diabetes stigma, they had higher diabetes-related distress, worse diabetes self-management, lower quality interactions with doctors, and they were more likely to engage in unhealthy eating behaviors compared to those who weren't internalizing diabetes stigma. Now, in this study, we also examined weight stigma in these adults with type 2 diabetes. Over half of them reported experiencing weight stigma, and more than 40% said that they felt judged about their weight by doctors. Again, adults who experienced weight stigma had higher diabetes-related distress. They had more unhealthy eating behaviors compared to those who were not experiencing weight stigma. And we saw the same pattern again when we looked at those who were internalizing weight stigma and blaming themselves, who were more likely to have diabetes distress, worse interactions with doctors, and worse health behaviors. So these findings tell us that high percentages of adults with type 2 diabetes are experiencing both diabetes stigma and weight stigma, and many are blaming themselves. And this has concerning implications for both their health behaviors and their health care. But we have a lot more to learn here. More research on diabetes stigma is needed so that we can really build a solid foundation of science that can help elevate awareness of this problem. We need to learn more about how prevalent diabetes stigma is and who is most at risk, and the ways in which diabetes stigma interacts with other stigmatized identities and how it impacts health and health care and what strategies will be most effective to intervene. If we want to successfully address diabetes stigma, answers to these questions are needed. And optimistically, we're seeing increasing calls for action in the diabetes field to elevate diabetes stigma as a priority. The International Diabetes Federation has identified stigma as a problem requiring attention and prioritized reducing stigma for people with diabetes. More recently, Diabetes UK has identified social stigma as a key area needing increased financial investment and research. And this year, the American Diabetes Association stated that addressing diabetes-related discrimination and unfair treatment is a key state and federal legislative priority. These are really important declarations, and they reflect the recognition that diabetes stigma is present and potentially harmful. So looking forward, the more that we can promote general awareness of diabetes stigma with the support of different organizations, the more we can encourage research and scientific attention to this issue. effective advocacy and societal change needs policy relevant science. So as we think about initiatives and strategies to address diabetes stigma, we need to expand existing research efforts to actively engage researchers, to strengthen the foundation of knowledge and evidence on diabetes stigma, to disseminate this evidence broadly, to educate and mobilize the medical community and inform policy initiatives, and to ultimately identify the most effective ways of ending diabetes stigma so that we can really shift the current culture of blame and shame to a culture of support and respect for individuals with diabetes. So I'll end there, and I'd like to thank you for your time and attention.
Thank you, Rebecca. I appreciate that. I mean, there's so many insightful things, but in particular, I love the shedding some light on this fact of like this vicious cycle, right? That there's a self-fulfilling prophecy around stigma, right? As well as the fact that there's evidence here, that, like you're providing scientific evidence, data, actual data points that tell us that diabetes stigma isn't just in our head, right? It's not just like something, oh, I know I shouldn't feel this way, and it's like something that I've made up. Right, it's like someone who has pain, right, and no one believes in the pain, right? Like it's not real. So I think both of those things really stood out to me, and I appreciate you sharing that with us today.
Thank you very much.